Doctors of Reddit, what was the wildest self-diagnoses a patient was actually right about? I work as a medical lab tech. We had a patient who came in insisting that her neighbor was poisoning her. Everyone dismissed her assuming she has some kind of paranoid psychosis. She remained in the ER on a psych eval. I ran all the standard labs on her and they were normal, but this patient would not budge. She was admitted to psych on a hold. At this point, one of the hospitalists decided why not and ordered labs to test for several heavy metals and ethylene glycol. Her ethylene glycol level was 32. 32. If she was legit being poisoned by her neighbor or if it was self-induced, but damn, that patient taught me a very important lesson that day. Not a doctor, but in junior high I had a little cough that just wouldn't go away. My grandmother was convinced it was whooping cough. I felt totally fine, it was just an annoying cough. She made me go to the doctor and told the doctor that she thought I had whooping cough. The doctor informed her that it hadn't been in our area in over 10 years, so she doubted that was the case. My grandma forced her to test me for it anyway. Turned out I was positive and considered patient 0. The whole school basically ended up getting it and we had to shut down for 2 weeks until it went away. Woman in her 40s came in and told me she was having seizures. I asked how she knew and she said her right hand would periodically stiffen. There was no loss of consciousness or other symptoms more associated with classic seizures, but I ordered tests anyway. Turns out she had been having multiple focal seizures. Patient here. Told my family GP, who I'd seen since I was a kid, and who worked with and saw both my parents as patients for years, that I thought I had reactive hypoglycemia. He scoffed. You don't have that. Why would you think you have that? I told him my symptoms. He was doubtful, but told the nurse to get me a Coke and made me chug it. Sent me to roam around the hospital for a little bit, then get blood work and come back. I came back, and his first words were, "This is so aggravating." Does that mean I have it? Yes, that means you have it. Not a doctor, but my aunt and uncle had a border collie that would bury his nose in my uncle's back when he was sitting on the couch or recliner. He would walk up, sniff and keep sniffing until my uncle would shoo him away. A bit later he would come back, sniff again and just stare at my uncle. A few weeks later my aunt was watching one of the local news channels and they featured a dog that could smell Parkinson's and she jokingly told my uncle about it. He mentioned their dog constantly sniffing one spot and one spot only on his back, so he went to a high school friend who was a doctor in dermatology. He said it didn't look right and did a biopsy on it. Sure enough, he had skin cancer, but they caught it early and all he ended up with was a scar on his back. This is why I usually ask patients what they think is going on or if there is anything they're specifically worried about. Either I get a good idea, or I can figure out a way to make them feel better about their concern. I'm a nurse, but just had a patient who came in for a colonoscopy due to constipation and pain with bowel movements. He told me prior to the test he felt like there was something catching on the left side of his abdomen when he pooped and was like, maybe I have a big polyp there or something. Sure enough, he ended up having a 2.5 centimeters polyp that we removed from that exact area. I'll never get to find out if that catching sensation ever went away for him, but I thought it was interesting that he was right. I'm a patient. I had a super painful skin infection on my face and neck that my dermatologist insisted was just an eczema flare-up. She prescribed topical steroids. They help in the short term, but I continued having painful rashes on my face. ETA, I asked if it could be a fungal rash, but the derm said she was sure it was eczema. Unfortunately, steroids weaken your immune system, thin your skin, and facilitate spreading of any infection. A few months later, my hands and fingernails get really painful. Life was hard because I was in pain when I tried to do normal things like write, type, open things, etc. Eventually, I started getting bleeding blisters on my hands and my actual nails turned yellow. I see the dermatologist because at this point I realize topical antifungals give me some relief, but I'd need oral antifungals to treat the actual nails. The dermatologist swore this was eczema dyshidrosis. I asked for a culture to be taken, and she took a swab, not a nail clipping, which is needed to diagnose fungal infections of the nails. So the diagnostic test of course came back negative. She prescribed steroids again, but I was hesitant to use them because at this point, I did not trust my dermatologist one bit. I see my PCP and tell him what's up. He agrees to try oral terbinafine, and it fucking worked. My nails fell out and grew back in, and the infection cleared up. The rashes on my face cleared up too. I was on the antifungal for 7 months. I had a follow-up with the dermatologist and showed her how the antifungals actually worked and to show her she was wrong. Patient, but I ran cross-country in college. My senior year my thigh aches. I told everyone something was wrong with my bone while being told it was a muscle issue. After being treated for every muscle issue in the book, I demanded an X-ray. I had a stress fracture more than halfway through my femur. I knew my partner had leukemia about a week before I could convince him to go to the doctor. He was bleeding and bruising really easily and had petechiae. I wanted to go to urgent care where I knew the CBC was done quickly on site, but he instead wanted to wait to go to his primary. I took him to his primary and had a bag packed for the hospital in the trunk. The doctor told him it was likely a B12 deficiency but that he'd do blood work to put my mind at ease anyway. I asked if the CBC was done on site or not, and he said it was sent out. I asked if he planned to rush the CBC. He got very angry and said, "There is nothing the CBC could show that would change my treatment plan." Then he told my partner he needed to stop me from Googling. We got a call that night from the lab that his WBCs were dangerously high and platelets were dangerously low and I had to immediately take him to the ER. I did, and he was diagnosed with acute leukemia. Had a patient who came into the ED with vague mild abdominal pain whose friend recently died of colon cancer. She was convinced she must have it too. Told her cancer wasn't contagious like that, but ordered a CT scan because she was so insistent in order to reassure her. Lo and behold, she had a huge colon mass. Very bizarre case. EM/ICU doc here with over 10 years of experience. While it's not quite a diagnosis, experience has taught me to take very seriously when a patient states he's about to die, even if he appears in a stable/controlled condition. Patients who have a life-threatening condition usually have a premonition about their imminent decompensation, which is usually preceded by very subtle signs of worsening that may be confounded with pretty much anything that happens on a resuscitation room or on the back of an ambulance. I've had patients who appeared to be in a completely stable condition, with acute conditions where cardiac arrest was not foreseeable, example, motorcycle accident with single limb injury, who briefly mentioned they think they are about to die before suddenly entering in cardiac arrest due to a malignant arrhythmia. It's believed that patients may perceive a sudden drop of blood pressure and/or the usual release and spike of adrenaline and other catecholamines as imminent death, but the reason why this happens is not clear. Some we are able to return, others we lose, or recover them to a state where death would be better. Had a patient come into the ED and told me he had epiglottitis, an uncommon infection of the epiglottis, part of your throat, when I went to see him. I asked how he knew. He'd had it before but was also a 90-year-old retired ED doctor. He was right.